The Endocrine System. Chapter 18. Excess and deficiency. An excess, too much, or deficiency, too little of circulation hormones cause a wide range of medical conditions. For example, hyperthyroidism and hypothyroidism. Where there is excess of hormone, one form of treatment consists of giving the patient something which inhibits the production of that hormone, as in the use of carbimazole to treat hyperthyroidism. When a hormone is deficient, treatment may be by replacement therapy. For example, injections of insulin in the treatment of type 1 diabetes. Doctors say sufferers of type 1 diabetes are deficient in insulin. Negative feedback system. TRH, thyroxine releasing hormone, is secreted in the hypothalamus and triggers the production of TSH, thyroid stimulation hormone in the pituitary. TSH stimulates the TSH receptor in the thyroid to increase synthesis of both T4 and T3, and also release stored hormone producing increased plasma levels of T4 and T3. T3 feeds back on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion. Goiter. An enlarged thyroid gland is called goiter. The enlargement may be diffuse, involving most of the gland, or localized, limited to a particular area. As in solitary, single nodule, the increased blood flow in diffuse enlargement, for example, in Graves' disease, may give rise to a palpable thrill, vibration felt with the hand, and an audible breath, noise heard through a stethoscope over the gland. A letter of referral. Mr. Davis' doctor has referred her to an endocrinologist. Dear doctor, I would be grateful if you will see this 50-year-old woman who has lost 20 kilos in weight in spite of eating more than usual. She described herself as overactive. At first, she thought the weight loss was due to this, but more recently, she has developed palpitations, diarrhea, and heat intolerance. Heat intolerance is inability to cope with high temperature. She has noticed that her hands have tendency to shake. Her symptoms suggested hyperthyroidism, and this was confirmed by my examination, which revealed an enlarged thyroid, red sweaty palms, and fine tremor of the hands. Overactive, more active than is usual, palpitations, awareness of rapid or irregular heartbeat, fine tremor, very slight involuntary movements. Complete the table with words from A, B, and C opposite. Verb: inhibit, produce, release, replace. Noun: secretion, simulation. Complete the passage from the textbook. Pulses of GnRH are released from the hypothalamus, and LH and FCH from the pituitary. LH, testosterone, from Leydig cells of testes. Testosterone back on the hypothalamus pituitary to GnRH, FSH, the Sertoli cells in the semiferior tubules to mature bands, and the inhibits HMB. Inhibit cause feedback on the pituitary to decrease FCH. Complete the sentence. Look at A and C opposite to help you. A change affects many parts of an organ or gland. A change affects only one part. His diet is in iron, he doesn't get enough iron. T3 and T4 increase the basal metabolic rate. Match Mr. Davis' symptoms with the question her doctor asked. Diarrhea, eating more, heat intolerance, overactivity, palpitation, weight loss, tremor. Do you prefer hot weather or cold? Is your weight steady? What is your appetite like? Are you always normal? Are you able to sit and relax? Do your head change? Have you ever felt your heart beating rapidly or irregularly.